All right, folks, this is Cimbolic of the Council of 12 reporting out to you on our show that took place yesterday, April 24th, 2010, and the topic was health care for the uninsured. We had as a guest Ms. Carol Clifton. She's an office manager in a large corporate dental office, so she interfaces quite a bit with insurance companies and was able to tell us primarily about the dental industry. Our topic in general was healthcare, but we tended to focus on dental healthcare, which was very, very interesting. You know, it's a neglected area of health. Society as a whole gives it secondary status. A lot of people don't have access to dental care, or even if they are employed and have an employer plan, oftentimes the employer plans are subpar. It apparently is just not accorded. Well, it's accorded secondary status in the healthcare conceptualization and industry, which is unfortunate. I mean, Cimbolic here, Nick. I use my mouth all day, talk, 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 talk. You know, it's a very important part of the health, and it can affect the whole system. For instance, infections below teeth, etc., can poison the entire bloodstream and can result in trauma to the heart, etc. So it's a very important part of healthcare. Where do you get healthcare if you are uninsured? Well, healthcare in general, there are often clinics, free health clinics in San Francisco. We have the Hate Free Clinic, for instance. There are also some hospitals that specialize in arranging and providing healthcare. CarlTSavage, the co-host, mentioned that Grady Hospital in Atlanta and Cook County Hospital in Chicago really have been founded on providing health care to people who need them. So those are important. Now, there may not be programs or hospitals or facilities like this all over the place, but in general, there are oftentimes dental care. Sometimes, if you don't have a dental health care plan, sometimes you can go to a dental school, and the students will work on the teeth, on the mouth, with no charge or for a very, very low charge. So if you have kids, you don't have dental health care, think about contacting some of the dental schools in the area, and it may be that there's a program there where qualified students will do the dental work. Simple things like cleaning, regular cleaning of the teeth to prevent gum problems, teeth problems. This can work out. There are, again, in terms of dental care, there are also some discount dental coverage policies which give you an advantage over just pure cash. They're less expensive than cash, and sometimes the dental offices can make arrangements when you show up for care. Though it's probably preferable in advance, but can make arrangements to hook you up with a discount policy plan. If you have a job, for those of us who are employed, we should lobby our employers for better dental health coverage and better health care coverage in general. For those of us that are unemployed, we have to seek out alternate ways to get the care. Clinics, as I say, schools, as I say, discount plans, whatever it takes for us to do that. We should all lobby the politicians, the legislators, to deal with this area. I'm not really familiar with the new health care plan that has recently been passed. I know that it does assist people who have previously been denied coverage due to pre-existing conditions. My whole life is a pre-existing condition, so there's some assistance there, but I don't know if we're really getting towards universal health care coverage. Since the recession of the early 90s, 20 years ago, the number of uninsured, medically healthcare uninsured, has risen by 1 million people a year. It's up to 47 million people now, Americans, in the United States, without care. For children, check into Medicaid, check into the state programs. There are programs that are meant to assist children. It's mostly the uninsured adults that have trouble getting any level of care. So, as I say, we need to lobby. If we're employed, we need to lobby our employers for better plans. All of us need to lobby our legislators for better plans. What else? There are healthcare advocacy groups. If you need healthcare and it's being denied, you can check those out on Google, etc. It's important to do some research. Health maintenance is very important. Disease management, early detection of diseases. There are some chronic diseases that really need to be monitored and maintained. Conditions like high blood pressure, diabetes. Many of these things are preventable. CarlTSavage, the co-host, did a lot of research in preparation for the show and talked about environmental factors. We should be aware of the environmental factors, sometimes invisible, like high tension wires, magnetic fields that can adversely affect our health. Diet, is very important. And basically, well, I guess practice wellness as well as just good healthcare. Wellness as a preventative measure. As they say, if you have your health, you're wealthy. And it's something we often take for granted until something manifests itself, and then we end up trying to deal with it. But usually things will manifest themselves when they're already in a stage of development that is much more difficult to treat. So, folks, if you have healthcare coverage and dental coverage, go there regularly, monitored, practice good health. Everybody lobby so that we get better coverage and more universal coverage. I mean, I personally will not be satisfied until every person in the United States has full healthcare, dental, optical coverage, just as part of being a citizen of the United States or being in the United States. Other countries do it. We have the most medieval medical system of the whole industrialized world. So for all our much vaunted pride in our economic system, it is underserving millions, tens of millions of people. It's an absolute disgrace as far as I'm concerned. So anyway, we can get there and improve it, the better. Anything we in our own personal lives could control, that's the best place for us to start. And also deal with it on the societal level. That's just the story, folks. Listen to the show. Link in the description box. It's our 27th show, and we're happy to bring them to you. Take care. Look forward to seeing you soon. Bye.